villages, it will go a long way in reducing the workload here, because instead of patient coming all the way from Fonyi with health problems, they can be rather seen at their various facilities. If they cannot manage those conditions or health problems, they can be referred to major health centers or hospital, the main referral hospital, Banjul. Or Brikama, even Brikama, they are doing operations now. So it will go a long way in cutting down the workload here.
The MDGs are the most successful global anti-poverty push in history.
At the United Nations, Secretary General Ban Ki-moon's statement is meant to spur member nations to move faster and deliver on their promises to reduce poverty and improve the health conditions of the peoples.
World poverty has been cut in half. More girls are in school. Child mortality has dropped. We are fighting killer diseases. The list goes on, but too many women still die in childbirth when we have the means to save them. Too many communities still lack access to sanitation. Too many families are still being left behind. We have 1,000 days to close the gaps, 1,000 days to accelerate action. Here are 4 ways to step up our efforts. First, scale up success through strategic, targeted investments in health, education, energy and sanitation. Above all, by empowering women and girls who can boost the results in all other areas.
It's not going to be easy, however. With hard work, these goals could be met even before 2015.
Well, normally hospitals in sub-Saharan Africa are almost overstretched with the sheer number of people who on a daily basis knock on their doors to receive treatment. The situation might not be as different from that of Jammeh Foundation for Peace Hospital, where we understand the numbers are also increasing as a result of the services being provided here. The good news is that the nurses here are also optimistic about the chances towards attaining the Millennium Development Goals which concerns health. Ibama Balde reporting for GRTS at the Jammeh Foundation for Peace Hospital in Bondo.
Life in most rural Gambian villages is mostly dull. This is partly due to many factors. Continuing with his series on rural Gambia villages, Ibrahima Balde gives us a comprehensive account of how the establishment of the first ever health center in Dongoroba in the Lower River region is poised to transform the lives of a teeming mass of people.
Most, if not all, Gambian villages are bonded by their shared cultural heritage that each settlement tends to stroke off at certain epoch-making events. Sometimes this bond, often referred to by historians as political alliance, is cemented and concretized at certain levels of societal endeavors. In the Gambia, the settings in the village, it goes without saying, is structured in such a way that almost every household is engaged in meaningful activities such as farming, business, or cattle rearing. Due to the various experiences Gambian villages encountered as a result of direct and indirect colonial rule several years back, some indigenous settlements basked in the development glory and distinctively stood out. Others, as history referred to them, were left in the cold. Most of these villages are today referred to by residents from far-flung communities as towns by virtue of the contact they have with outsiders or as a result of the geographical location they found themselves. In the Gambia, suffice it to say that the country is strategically apportioned into 5 political and administrative regions. What's more distinctive is the power and influence of religion, especially Islam and Christianity, as a bargaining chip during the 18th and 19th century Gambian history. After the infamous religious war that swept across large swathes of land now called villages and towns, people started to settle down with their kith and kin to various places and found families. Since land was available free of charge, families that were keen on practicing what their elders had bequeathed to them founded new settlements. One indigenous settlement that was swayed by Islamic religion is Dongoroba village in Jara East, Lower River region. It is one of the smallest villages in the country with a closely knitted extended family network. Instead of sending their children to receive Western education, in some cases to far-flung communities, parents in this indigenous Gambian village send their kids to study the Holy Quran, which explains why at the start of any public program or meeting, the guardian listen with keen interest melodious recitations of the Holy Quran.
محمد رسول الله والذين معه عشداء على الكفار رحماء بينهم تراهم ركعا سجدا يبتغون فضلا من الله ورضوانا سيماهم في وجوههم من أثر السجود ذلك مثلهم في التوراة ومثلهم في الإنجيل كزرع أخرج شطعه فآزره فاستغلظ فاستوى على سوقه يعجب الزراع ليغيظ بهم الكفار وعد الله الذين آمنوا وعملوا الصالحات منهم مغفرة وأجرا عظيما صدق الله العظيم.
Despite all this, the rural-urban migration took a good chunk of the youths away, thus made it difficult for an extended family that depends on many hands for subsistence agricultural ventures to cope. Having been inspired by the development initiated by the Jammeh administration from 1994 to date, the efforts been made to deliver affordable medical health care. The Minister of Health and Social Welfare, Balagaba Jahumpa, said the health center project, funded by Alhaji Cherno Lamin Dem, the first in the history of the village, was a classic example of what the president referred to as patriotic citizen.
When President Jammeh talks about patriotic Gambians contributing towards the socio-economic development of this country, the example of Fafadem is there for all to see. The construction of this health facility in Dongoroba is indeed the cornerstone of the July 22nd revolution, headed by our leader, His Excellency Sheikh Professor Dr. Alhaji Yahya Abdul Aziz James Junkung Jammeh, in addressing the needs and aspirations of the Gambian people, and in this case, in addressing the health needs of the Gambian people.
The recent inauguration of the multi-million-dollar health center that made it possible for patients to live side by side at the health center with their doctors was a watershed moment in the history of Dongoroba. Like so many Gambian villages along the Banjul-Basse Road, the establishment of this health center is good for business. Full-time business dealers who badly needed customers are now jostling for space in this area, which by all indications appears to be fertile for meaningful business activities. If you want to gauge the reactions of the people, take your microphone out. One would surely hear what the street hawkers have to say about the construction of the health center.
Min Alhaji Job lopitan Dongoroba yettare Allah mawde min keɓi hen gos ko ganduɗa yimɓeɓe foof ɓe ɗum poɗano ko ɗum jatake nde aɗum addata dowma si tawma a jooɗima ha Allah addanma ɗum lesma an hamdinare poɗɗa hen wat minen ala komin mbawi wi he kulle Dongoro sina min pini foof nguron duwano ɓe ganduɗa ɓe mbaɗi sponsor kulle l'hôpital o surtout ala haji mo ganduɗa mo ardi ɗum yo Allah nawrumo yesso ɓeyda bawga mako
sabu de kono bili o fuɗɗimo liggey minen rewɓe saara ɓe ha he worɓe ɓe danaka fondinkoɓe foof jenti mbabotiri mbaɗi ɓernde wattare o meeɗa wi imme min mbiɗi ɗiɗi soyma imme min fof min immo ha Allah walli min ma o arda min ma ha min kimma komin jiiɗi ko joni sona mbuɗon belti on min jogui min fof haali.
The representative from the governor's office in Kolda in Senegal said this small community had demonstrated clearly their readiness to open up to their neighbors in Casamas to receive treatment at Dongoroba Health Center. something which, according to the